Thank you, Rob. Good morning. I'm Steve Berger with AT&T, our Emerging Devices organization, and I'd like to introduce my colleagues, Stephanie Ellenberg, Cameron Corsi, Andy Spence, and then Craig Kaiser is in the audience. And what we'd like to do this morning is just spend a few minutes and talk about what AT&T is doing in the healthcare space and how we might be able to partner with many of you. Before we do that, however, I would like to acknowledge that we are painfully aware of the signal issues here at the hotel. So this is something that our local market is working on, and we're not going to have it resolved today, but we do appreciate your patience and understanding on that. So what we'll do is spend a few minutes and give you an idea of what our group is all about, how it came to be, and then we'll talk a little bit about our certification process, technology enablement, and then focus a little bit on business models. So first off, how did we get here? Well, as we saw yesterday, wireless penetration in the United States is approaching 100%, and it's going to continue over the next few years. Data usage has also increased substantially over the last 4 years, and at AT&T alone, over the last 3 years, we've seen an increase of almost 5,000% in data usage. So this led about 2 years ago to our chairman, Randall Stevenson, to create the Emerging Device Organization with the purpose of bringing connectivity to innovative new devices in the marketplace for key customer segments. So our charge as a team is to help build the relationships, help drive the ecosystem, and help bring those products to market. So to give you an idea of the types of devices that we're working on and some of the key categories that we're focused on, we have a strong focus on computing devices, consumer electronics devices such as e-readers, gaming devices, picture frames. Got a strong focus on automotive, navigation, and tracking. And then healthcare is the most recent category where we've invested a significant amount of resources. So what exactly is our approach to healthcare? This slide really represents our charter in the healthcare space. And with healthcare spending exceeding $2.5 trillion now in this country, and about half the population having some sort of chronic disease that they need to manage on a regular basis, our vision is really to be the technology leader in the health and wellness industries. We want to help to drive the entire ecosystem, want to help increase productivity, reduce costs, and support overall health and wellness wherever we can. Now, we do have two teams at AT&T that are focused on healthcare. On the enterprise side, that group is focused primarily on smartphone applications and platforms, and then our team is focused primarily on connected devices, and these would be non-smartphone type connected devices. And to give you an idea of what we're talking about, as you saw yesterday with Dr. Soon Shin, the connected pill bottle is one of these devices, and in spite of what we saw yesterday, it actually does work quite well. We're also working on home health hubs, body sensors, glucometers, and so forth. So really anything that would touch remote monitoring, chronic disease management, and overall health and wellness, we want to help bring those products to market. So what I'm going to do right now is turn it over to Stephanie Ellenberg, and she's going to walk through our certification process and our technology enablement.
Thanks, Steve. Good morning. Actually, I'm only half of this technology show here. Cameron Corsi, who's my counterpart in product development, will actually be taking you through the device certification piece. And what I would just like to cover briefly is starting with AT&T's technology roadmap. And as Dr. Jacobs mentioned yesterday in his discussion, HSPA is 3G technology that AT&T has deployed, which is Qualcomm-based. And we launched that in 2008 and have been subsequently upgrading that technology with new versions over the last 2 years. We did 7.2 in 2009, which essentially doubled the downlink capability or data speed versus the 2008 deployment. And we also, over this past year, have continued to improve that service by deploying HSPA Plus, which is 14.2 on the downlink. So an almost 2 times the data rate that we had in 2009 on the downlink. And in conjunction with that, we've also been enhancing our backhaul between our cell sites and switches to facilitate those higher data rates and also to prepare for our LTE deployment, which is coming in 2011. And admittedly, we will be a little bit behind our competition on our LTE deployment. We've done some trials in 2010, and our commercial launch is planned for next year. We feel like with our timing, it will coincide better with the widespread availability of devices that can support LTE. And also, we feel like we have a more robust solution with the fallback to HSPA+. So to give you a little bit more detail on how we actually connect our partners' devices, this diagram is very high level. Oops. Go back. Sorry about that. Very high level. But essentially, we have what we feel is a very secure and reliable design and engineering with our network. And so one of the things that we do support is network-enabled 128-bit encryption over 3G. And also, we use custom APN connectivity for keeping the traffic segregated. And we also leverage existing standards-based protocols for connectivity between our partners' network and our network. So either MPLS, frame relay, or IPsec. And also, AT&T has geographically redundant data centers, which supports business continuity. There we go. And I could go into a lot more detail, but rather than do that and bore you with a lot of slides, I'll point you to our EDO-specific website where you can get a plethora of information on our organization, our distribution, more information on our network. And also, I wanted to point out, it's not on the website yet, but we are planning a developer-specific conference as part of the upcoming Consumer Electronics Show in Las Vegas in January. And so if you check out the news and events portion of the website in the coming weeks, you'll see some information there, and we hope to see some of you participate in that activity. So with that, I will turn it over to Cameron.
Thanks, Stephanie. So one of the things that we're trying to do is make it very easy for new devices, health-related devices and other kinds of emerging devices to access AT&T's network. And we're doing that by really increasing the size of the team and the resources, including monetary resources that we've thrown at this emerging device space, and to all of the ecosystem that you saw Steve Berger talk about. We've done that by building a new network-ready lab, is what we call it, in Austin, Texas. We spent more on that than the $6 million man to build that up last year so that we would have a good facility with test equipment. It has 8 different screen rooms. They look like big meat lockers, if you've ever seen them, where you can isolate the radio environment. They're filled with test equipment that we can test anywhere from the lowest layers of the radio stack up through, if you're familiar with radio, at least layer 4. And what we try to do is leave things above layer 4, more of the application layer stuff, up to the innovation of the market. What we want to do is make sure that the radios that are embedded in these devices, like the pill cap, or in the future other kinds of medical devices that want to touch our radio network, we want to make sure that they work properly and that the network is protected against excessive signaling and things like that, and that a customer has a good experience on the radio side with it. But we try to leave all the rest of the innovation up to the industry and try to stay out of the way of that innovation as much as possible. So you can see here on the graph on the right that we have increased year by year the number of what we call emerging devices that we are certifying significantly from year to year, so that this year we're planning on certifying as many as 500 emerging devices. And this includes categories for the enterprise as well as this emerging device segment that we're talking about here. And we're doing that as a result of the extra funding. Initially, we had this program under the same kind of testing that we did smartphones, and it became just too big. And so we have a lot more capacity to work in this space than we used to since 2008 when we started building this lab. So one of the things that is key to getting to market quickly with a medical device, let's say, that has cellular network technology in it, and the key for us to certify a lot of those devices on our network is the use of what we call already approved radio modules. Basically, you might think of these like freeze-dried, food, right? They already are packaged. They've already gone through a significant level of testing, both in the laboratory and in the field, many weeks of testing. And because of that, we already know that this radio works very well on our network. So we don't have to work as hard nor spend as much time on the end device that these radios go into. And we have oodles and gobs of these radio modules already approved that can be selected. We have a website location here where you can download information on them. And they come in various form factors. If you're familiar with different packaging of components, you can get them in surface mount, which is solderable form factors like ball grid array or land grid array. Or you could get them in connectorized, maybe a PCI, mini PCI form factor. So they come in various form factors. They come from many different suppliers around the globe, actually. More than 12 different radio module suppliers are out there that we work with and pre-approve their modules. And also they're supported. So there are, let's say, radio doctors out there who know all about how to get these radio modules integrated into end devices so that they work well. That support comes from the radio module suppliers or even RF consultants. And you can find a list of those RF consultants on that website that Stephanie referred to earlier regarding EDO. And so the thing that you need to remember, let me see if I can get this next slide going here. As you are integrating one of these radio modules into an end device, you just remember something called ICS, integrate, complete, and submit. You need to integrate the radio module into this medical device. And to do that, as I said, there are a number of them you can select from. And then the integration support can come from the radio module supplier or an RF design house if you don't have the ability to do that yourself. And then you complete a set of tests. So you have to complete FCC emissions tests, some industry tests that get you the serial number that you can use then in your radio. And then some AT&T pre-tests. So we have some labs out there that you can go to, have your device pre-tested in these labs. And then what you do is you submit that documentation, the test results, to AT&T, along with 4 devices. And 2 weeks later, we come back, and if everything passed, if everything looks good, your device is certified, it's approved for use on AT&T's network. It's as simple as that. So we try to make this cookie cutter as much as possible, and we're always trying to look for ways to streamline this process to make it easier. So also any hints or advice that you have for us or suggestions, we would love to take on how to make this process simpler for you. And finally, I don't want to leave this topic without making sure that you're aware of one other thing, and that is the importance of the radio design. get to the right slide here. There we go. The key thing that we have noticed when radio modules are integrated into devices is you have to know a lot about antennas and antenna placement. And that is an art form. Some call it a black art. It is a challenge for some people, and that's why some of these consultants are very good out there, because the placement of that antenna is critical for you to pass emissions tests with the FCC, and to make sure that the device is transmitting at enough power and is able to receive the signal at a low enough level to be able to make the link back to the cell site. And also, the placement of components and the antenna in there is important, because any kind of noise that is induced into the radio by the components, the electronic circuitry, can desensitize that radio and can cause it not to work well. So this is very important in your designs that you consider this. It really should be designed in from the start of the process. I can't emphasize that strongly enough, that if you work on it early, this process is very simple and can go very well for you. Okay? So with that, I'm going to turn it over to Andy Spence, who's going to talk more from our strategy group about the different business models that we have in place for emerging devices.
Good morning, everybody. Thank you for your time today. I just wanted to run through a couple of quick slides on how AT&T would like to work with partners to bring products to life. And I just have a few, but the two kind of key things that I want you to come away with from my slides specifically are, number one, we're very flexible. If you're thinking that AT&T is trying to jam its brand and a retail rate plan on every single product, that's not the case. Specifically in our group in emerging devices, in fact, it's our charter to go out and look widely at all kinds of opportunities that may or may not include our brand, our distribution, our specific pricing plans. And then, secondly, we have a lot of experience and believe we can provide value to the extent that any product partner wants that experience and wants to take advantage of that experience. We think we can provide a lot of value in terms of the 4 Ps and pricing, placement, promotion, price, and we want to work with you on all of those things to bring your product to life. So please don't think of us only as the guys who bring cell phones and the home phone. Think of us as a real consumer products company that, again, can provide that experience and value on whatever your product might be. So I'll just go to the first slide here. Think of the, the left side of the slide as the evolution of a piece of plastic that's been engineered that perhaps has software designed in it that's providing some level of value, and kind of working its way down the slide to now it's a connected device that is transferring information back and forth, and potentially because of that transfer of information is providing value to the end user. You as as a product developer, perhaps you have that intelligence in the device itself that is providing feedback to the customer, but there are ways obviously where through the transfer of data off that device out into a server somewhere or a cloud somewhere is then again providing value back to the customer that is not inherent in the device itself. So on the right side of the slide, a couple things that I want to mention are from the standpoint of actually sourcing the device. You know, we work with Nokia, RIM, LG. Those companies are obviously enormous They have all kinds of form factors that they're developing. They've got a lot of experience on how to make something that a customer is not afraid of, frankly, and works easily. And so we can certainly work with them hand in hand with a partner who has an idea but doesn't exactly know how to bring it to life from a hardware standpoint. So we could be potentially helpful in adding value in that respect to actually source a device that makes sense and is intuitive for customers once it's in their hands. As Cameron and Stephanie touched on, with respect to radio selection and potentially sourcing, and then obviously design assistance, that's obviously a core competency of ours. Cameron mentioned the pre-approved radios that we have, but again, we can provide assistance and a partnership as your company moves through deciding how to get a module, what kind of module they want. And we do want to emphasize that, again, we're a resource to be used. We will stand there side by side with you if you want that kind of assistance. But again, we're not looking to force ourselves in that process. We want to be a consultant more than anything else. And then all the items in green get back to my point about seeing us as a consumer products company where we have a lot of experience on price plans, out-of-box experience. When I have this discussion, I think about, I don't know if you guys remember, back when computers were really starting to take off and the customer service calls that would come in, and a lot of people called and said, my computer that I bought from you is telling me to press any key, and I can't find the button that says any key. And then there was the one where, I'm trying to turn this thing on, nothing happens, and the customer service representative is saying, well, where, have you pushed the on button? And the person's saying, I've stepped on this thing multiple times and just nothing happens. And the person was stepping on the mouse thinking that it was like a foot pedal that would, bring the computer to life. So obviously we want to avoid those types of situations. We want this to be very easy out of the box. And clearly in this space, we're talking about demographics that that are a very wide spectrum. So not only do you have obviously elderly population, but you've got a lot of young people as well that may get a lot of value out of these types of devices. And so making sure that it's very easy, very intuitive. Again, we think we can provide help in that way. So the next two slides kind of emphasize the flexibility that I mentioned, where AT&T is agnostic to where we fit in the presence on the device, if you will. Obviously, we have shareholders. We need to make a profit. But again, in terms of our brand and whether it's a rate plan that is sponsored by us versus a way to purchase and buy connectivity that has very little to do with anything that we have in place today. Again, we want that door to be wide open. We want you to see us as being very flexible in this respect. So by way of example, I just want to walk you through kind of three ways with products that we have in place today where the model for us is very different, again, with respect to our brand and our rate plan. So maybe the easy one, because we'll start on the right. People know us as a connectivity and a network company. We work with PC manufacturers to make sure that the 3G connection in their computers works very well, and we attach a rate plan that's an AT&T rate plan to that, because Dell and HP are not interested in coming out with their own rate plans. They build computers. We put our rate plans associated with that. We're very upfront in terms of branding, and so people buy connectivity from us to associate with their computer. There is, in that particular model, although this is evolving, that can at times be associated with a contract and a subsidy. So as you guys probably know, the value of that contract allows us to pay the distributor some money up front, and then they typically use that to subsidize the device so that the hardware is cheap, and that's a model that we work quite well with in both computing and obviously mobile phones. Then the middle example is the iPad, where slightly different. We're not as present there. We're not as obvious there. Yes, there's our little emblem at the top. Yes, it is our rate plan, but it's much more behind the scenes. It's not subsidized. There's no contract associated with it. Customers, if they want to buy connectivity, put in their credit card information and away you go. I'm sure, and I hope many of you have iPads and are happy with them. It's just very flexible. It's a very easy way of doing business and getting connectivity. And then the furthest example on the left is really where, again, we want to make sure that everybody understands that we're very open to this model. We're, again, in emerging devices, bringing up a lot of products with this model where we're the wholesaler. Our brand is almost nowhere to be found. Very little, if any, distribution assistance on our part. Amazon comes in and says, we have our product, we've got our distribution, we just need your help making sure that when someone wants to download content, it works really great. And again, when they open the box, they don't have to do a whole lot to figure out how to download content. So we do a lot of the examples on the left that are maybe not as prominent, as widely talked about, but again, we want to make sure that you know that's out there, and we're very willing to pursue that type of model. So just a few more things. There's no subscription, there's no device subsidy, and basically we don't really have any relationship with the end customer. Our customer at that point is Amazon, and they're a very good customer, by the way. And we work together to innovate with them in a variety of ways on potentially new products, including the Kindle, and it's been a fantastic partnership for us. So this slide's a little repetitive. Again, just kind of note the arrow, right? We're depending on the example, we're designing and helping to design more of the product offer and the experience, which we're very willing to assist and do. But again, we'll certainly play with example one, where a customer comes in with the product. They've got the way that it works, that they want it to show up out of the box. So they're just looking for our help in terms of making sure, again, the connectivity experience is superior. Okay, so thanks again for your time. I'm going to hand it back to Steve to wrap this up for us.
All right, I know we're against our time commitment here, so we appreciate you all taking the opportunity to listen to us, and we appreciate the opportunity to be here. And Craig and I will be here through the end of the conference if you have individual questions, so we'll be happy to answer those at that time. Thanks.